Good afternoon. This is Dr. Murli Bharadwaj, your classmate in everyday NEET PG preparation. Today is August 31st. Another 4 months before you are going to face the NEET PG. So, every topic in about 5 minutes, 15 hot points. That is my entire goal, to make you the masters, to consolidate your preparation and all the hard work you have done in across the year. Now let us talk about Mycoplasma pneumonia. Point number 1, it is a atypical pneumonia. Streptococci, staphylococci, they all lead to typical pneumonia. This is called atypical pneumonia. It leads to erythema multiforme. Please don't forget. Erythema multiforme, those target shaped lesions, all of you know very well, right? Now, mycoplasma lead to cold, not warm, cold autoimmune hemolytic anemia. And what is a very characteristic clinical vignette, doctor, in the exam? There are flu-like symptoms in the patient which have preceded a dry cough. If that is given in the history, you need to think about Mycoplasma pneumonia. Now, typically the patients are young patients who get mycoplasma. There is a bilateral consolidation on the X-ray, and mycoplasma is one of the causes for erythema nodosum, which is nothing but paniculitis. A favorite question of the examiner: what are all the causes of the erythema nodosum? A lot of times NEET PG में इमेज बेस्ड क्वेश्चन दिया जाएगा. एरिथेमा नोडोसम का एक क्लिनिकल पिक्चर देके एग्जामिनर पूछेगा, कैन यू रिकॉग्नाइज व्हाट आर द कॉजेस? सो यू शुड बी वेरी श्योर. Mycoplasma also lead to meningoencephalitis. Mycoplasma is implicated in Guillain-Barré syndrome, acute post-infectious polyneuritis, Mycoplasma pneumonia, and bullous meningitis, where there are painful vesicles on the tympanic membrane. You should think of mycoplasma. Mycoplasma also can cause pericarditis, myocarditis, and hepatitis and pancreatitis. It can also lead to acute glomerulonephritis, which is the organ that can escape the effect of mycoplasma after all. What is the treatment? Favorite question of the examiner. Don't think about penicillin for this organism without cell wall. What do you think as a treatment? Erythromycin is the treatment of mycoplasma, is what you should remember. Then, doctor, you have tropical eosinophilia. What are the causes of tropical eosinophilia? Favorite question. Most common is filariasis. Always most common will be a common infection that you see in clinical practice. Filariasis. Even ascariasis and xylostoma, toxocara, they are all implicated, is what you should remember. Now, what are the drugs that lead to drug-induced eosinophilic pneumonia? Favorite question. Once more, batti marne wala question hai ye bhi. Reasons, at least एक मर्तबे आप याद करना पड़ेगा. Nitrofurantoin, sulfonamides, penicillin, chloropropamide, thiazides, very commonly used diuretic, tricyclic antidepressants, hydralazine, INH, even isoniazid can cause drug-induced eosinophilic pneumonia, and PAS and gold salts, even they lead to drug-induced eosinophilic pneumonia. Causes are very, very important. Then, doctor, eosinophilic myalgia syndrome. Lot of times in AIMS PGI question bank अगर आप देखें तो this is a favorite question. L-tryptophan nutritional supplement के form में L-tryptophan दिए तो it lead to eosinophilic myalgia syndrome. Please don't forget. Now, Loeffler's eosinophilic syndrome, 3 points आप याद रखना. It is a benign, acute eosinophilic pneumonia, unknown cause. What is very characteristic about Loeffler's eosinophilic syndrome, doctor? A lot of times this question is asked. It is a migrating pulmonary infiltrate. This week it will be in the upper lobe of the lung. Then it will go to the lower lobe of the lung. So migrating pulmonary infiltrates with very minimal clinical manifestations. Clinically, patient will not have as many symptoms as what the X-ray is showing. So that is a classical feature of low-flex eosinophilic syndrome. You should not forget, which is unknown cause. Now, what is acute eosinophilic pneumonia, doctor? When do you call it acute? Any acute febrile illness with eosinophilic pneumonia lasting less than 7 days. That is important part of definition. And if you look at the history in the clinical vignette given by the examiner, there is no history of asthma. That is very important to remember. Otherwise, asthma ka history hai or eosinophilic pneumonia hai, so you will think of asthma only, right? Now, there is a hypoxia if you do pulse oximetry in acute eosinophilic pneumonia, and there are pulmonary infiltrates. Finally, doctor, chronic eosinophilic pneumonia. You need to remember 2 points about this condition. There are peripheral infiltrates in the lung. They resemble photographic negative of pulmonary edema. This is a very key word that you need to remember. Photographic negative ke jaise pulmonary edema will be perihilar bat wing type of a edema. You know that very well. And this looks like a photographic negative of the pulmonary edema present peripheral infiltrates, that is chronic eosinophilic pneumonia. Then a chronic eosinophilic pneumonia, one important point you should know is, if you initiate glucocorticoids within 48 hours, all the symptoms, chest x-rays, everything will clear. Now you are very confident. अगर एग्जामिनर न्यूमोनिया और इस्नोफिलिया के बारे में बात करें तो आपको फटाफट करेक्ट आंसर देना आता है, क्योंकि यू आर ऑल लिसनिंग टू डॉक्टर मुरली भारद्वाज, योर एवरीडे क्लासमेट in NEET PG preparation. Please call 9000868356. We have almost 50,000 students in various WhatsApp groups, study groups for NEET PG who are seriously preparing every day, across the day. You have hundreds of MCQs which are being discussed, debated by the serious students who make you keep hot about the exam preparation. So please don't forget to call and join the WhatsApp group, study group. And you have many more videos coming up in the same line. Good luck for your preparation.